Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Breast abscess. So this is common in case of the lactating mother. In acute painful conditions, the breast it cannot be compressed and mammography is not done. So in painful conditions, the mammography it is not done. And the IOC here is nothing but the USG. The sonographic features, if you see, it is suggestive of the breast abscess. And there is hypoechoic collection, and mostly it is multiloculated. There is no vascularity within the collection. The posterior acoustic enhancement is seen. It is seen, and this is due to the fluid content. Next is an echogenic vascular rim is also seen. Now let's look into, for better understanding, the Birat scoring. So what is the Birat scoring? Birat scoring stands for the breast. Birat stands for the breast imaging, reporting and the data system. So what is 0? 0 stands for the incomplete assessment, and this additional imaging. Imaging is required. Additional imaging, and likelihood of cancer is it is not applicable. Next is 1. 1 means the category is negative, and the management is routine annual screening is done. And likelihood of cancer is there is no cancer which is detected. Next is 2. 2 means it is benign. Benign means the routine annual screening is done and the likelihood of cancer is 0%. Then 3 is where it is a likely benign. So 2 you are very assured it's benign, and 3 it is probably benign. And here the follow-up after the months and earlier as advised by the physician. And here the amount is about 0 to 2% of the likelihood of cancer. Next comes 4. The 4 is probably malignant. 4 means it is probably malignant and the breast tissue biopsy is recommended by the physician. So it is probably benign, and then the 4 is probably malignant. The breast tissue biopsy is recommended by the physician. So here for ABC, it is amounts from 2 to 10%. So 2 to 10, then comes to 10 to 50%, and then 50 to 95%. Lastly, we move on to the 5th and 6th. So 5th is the malignant, and the biopsy is done essentially. So you do the biopsy, and here the likelihood of cancer is over 95%. Then comes the class 6. Class 6 is where the biopsy is proven, malignancy is seen. Biopsy proven, malignancy is done. And here the oncologist does the further treatment evaluations, and the cancer here is already present in this stage. To learn and grow daily like this, please do subscribe.